Ovarian cancer has no obvious early symptoms, and by the time Mary Raftery went to her GP with a bloated stomach and loss of appetite, the disease had already taken hold. After surgery and chemotherapy, she is now doing well, but wishes she'd known sooner.
The surgery wouldn't have been so extensive, so I would have recovered more quickly. More importantly, I think it's the long-term outlook, because although I'm in remission at the moment, few people of my stage make it beyond 5 years. Early detection makes such a lot of difference.
Scientists already know raised levels of a protein called CA125 in the blood can be a sign of ovarian cancer, but it can also indicate liver cirrhosis, appendicitis or heart problems, so the tests aren't reliable enough for national screening. At the University of Texas, they used the test to sort patients into risk groups. They looked for the protein in over 4,000 women. Those deemed low risk then had an annual blood test. Those with medium risk had another 3 months later. And high-risk women were given an ultrasound straight away to look for tumours. Over 11 years, they say the method helped with early detection, which means a 90% survival rate against 30% when caught later. But doctors here are cautious.
The results are promising, but it's still early days and it was a fairly small trial. We're actually running a study here in the UK and the results will be available in 2015. And that's a much larger study looking at over 200,000 women. So that will give us a much better indication whether this test is reliable enough to be part of a national screening programme.
Mary hopes it will be. Anything to halt the disease that kills 12 UK women every day. Tessa Chapman, 5 News.